I want to talk to you today about a small tablet that millions of people take first thing every morning, usually for the rest of their lives, and that is one of the most prescribed medications in the world. Levothyroxine, the thyroid tablet. And I want to talk about it because it is unusual in a specific and important way. It is a hormone replacement, not a drug in the ordinary sense, which means the goal is not to treat a symptom but to restore a level. And that in turn means two things follow. First, that the dose has to be right rather than simply adequate because both too little and too much cause genuine harm. And second, that how and when you take it affects how much of it actually reaches your bloodstream to a degree that is true of very few other medications. And that second point is where most of the practical problems come from, because a very large number of people are taking this tablet in a way that reduces its absorption significantly, and nobody has ever told them. So today I'll explain what your thyroid does and what the tablet is replacing, the timing and absorption rules that genuinely matter and that are so often got wrong, the interactions with other tablets and foods that reduce its effect, why the dose changes as you age, and why overtreatment is a particular danger after 70, what your blood tests actually mean, the symptoms that suggest your dose is wrong in either direction, and the questions worth asking at your next review. And as always, none of this is a reason to change your dose on your own, which with this medication matters more than most. Let me begin with the gland. Let me explain what your thyroid does because it makes everything else make sense. Your thyroid is a small butterfly-shaped gland at the front of your neck, and it produces hormones that set the metabolic pace of essentially every tissue in your body. Think of it as the thermostat and the accelerator combined. It influences your heart rate, your body temperature, your energy production, your digestion and bowel speed, your skin and hair, your muscles, your cholesterol level, your mood, and your thinking. When it becomes underactive, which is what levothyroxine treats, everything slows, and the symptoms are consequently everywhere at once. Fatigue that sleep doesn't fix, feeling cold when others are comfortable, weight gain despite unchanged eating, dry coarse skin and thinning hair, constipation, muscle aches and cramps, slowed thinking and poor concentration, low mood, and, as I mentioned in another video, thinning of the outer third of the eyebrows. And here is the reason it is so consistently missed in older adults. Every single one of those symptoms is what people expect from getting older. So, a 75-year-old who is tired, cold, constipated, slow, and low in mood is very often simply presumed to be 75 when a single cheap blood test would find a treatable condition. Now, what the tablet is. Levothyroxine is a synthetic version of thyroxine, or T4, which is the main hormone your thyroid produces, and your body converts it as needed into the more active form, T3. So you are not taking a drug that does something to your body, you are replacing a hormone your body should be making itself, and that is why, for most people, this is lifelong treatment, and why stopping it means the symptoms return over the following weeks. So your thyroid sets your metabolic pace, an underactive one produces symptoms that mimic aging exactly, and levothyroxine is straightforward hormone replacement rather than a drug in the usual sense. Now, the part that most people get wrong. Here is the practical heart of this video, how and when to take it, because absorption is genuinely finicky and a great many people are getting substantially less of their dose than they think. Rule 1. Take it on an empty stomach. Food significantly reduces absorption, and the standard advice is to take it at least 30 minutes and ideally 60 minutes before breakfast, with water only. Rule 2, and this is the one that surprises people, coffee. Coffee substantially reduces levothyroxine absorption, and this is well documented, so the very common habit of taking the tablet with the first cup of tea or coffee of the day is genuinely undermining it. Wait the full hour before your coffee if you possibly can. Rule 3. If morning dosing on an empty stomach is impossible for you, and for many people it genuinely is, there is a well-supported alternative. Taking it at bedtime, at least 3 hours after your evening meal, and studies have found bedtime dosing to be as effective or slightly better than morning dosing in terms of hormone levels, so it is a legitimate option to discuss with your doctor. And for many people, it is far easier to be consistent with. Rule 4, be consistent because consistency matters more than perfection. Taking it the same way every day allows your dose to be adjusted correctly to your actual absorption, whereas taking it with food some days and without on others produces fluctuating levels that make the blood tests hard to interpret. Rule 5: take it with a full glass of water and don't lie down immediately, since the tablet can occasionally irritate the esophagus. And Rule 6 on missed doses: if you forget, take it as soon as you remember unless it's nearly time for the next one. And some doctors advise taking two the following day if you miss one, but ask your own doctor for their preference and don't simply skip repeatedly. So take it on an empty stomach, wait an hour before coffee, consider bedtime dosing if mornings are impossible, and above all, be consistent. Let me give you the interactions because these matter a great deal with this particular tablet and they are extremely common. First, and most important, the supplements and medications that bind levothyroxine in the gut and prevent it being absorbed, and the big ones are calcium supplements, iron supplements, and antacids containing aluminium or magnesium, all of which are extremely commonly taken by older adults. The rule is a 4-hour separation, so if you take calcium or iron, they must be at least 4 hours away from your levothyroxine, and taking them together, which many people do because it seems tidy to swallow everything at once with breakfast, can reduce absorption dramatically. Add to that list multivitamins containing iron or calcium, and the medications used for high phosphate in kidney disease. Second, the acid-reducing medications, omeprazole and its relatives, which I discussed in another video because levothyroxine absorption depends partly on stomach acid, so long-term PPIUs can increase the dose you need. Third, some cholesterol medications, particularly cholestyramine and cholesevolum, which bind it in the gut and also need separation. Fourth, and worth knowing for anyone with a heart condition, amiodarone, which affects thyroid function directly in complex ways, and lithium. Fifth, estrogen-containing hormone treatments, which can increase the dose required. Sixth, high-dose biotin supplements, which don't affect absorption but interfere with the blood test itself and can produce misleading results, so tell the laboratory or stop them a few days before your test. And seventh, on foods, high fiber meals and soya products reduce absorption, which is another argument for the empty stomach. So, separate calcium and iron by 4 hours, mention acid reducers, and be aware that biotin supplements distort the test rather than the treatment. Now, the dose and why it changes. Let me talk about the dose, because after 70, there are some particular considerations that are worth understanding. First, older adults generally need lower doses than younger adults because the body clears the hormone more slowly and because lean body mass declines, so a dose that was right at 55 may be too much at 75, which is one reason the dose is periodically reviewed rather than fixed forever. Second, and importantly, when levothyroxine is started in an older person, particularly one with heart disease, it is started at a low dose and increased slowly, deliberately, because raising the metabolic rate too quickly increases the heart's workload and can provoke angina or arrhythmias. So if your doctor is creeping your dose up over several months, that is careful practice rather than indecision. Third, the reason both directions matter, because with hormone replacement, it is entirely possible to be overtreated, and overtreatment is not a trivial matter after 70. Too much thyroid hormone, even at levels that produce few obvious symptoms, is associated with two significant harms in older adults: atrial fibrillation, the irregular heart rhythm I've discussed at length that substantially raises stroke risk, and accelerated bone loss leading to osteoporosis and fractures, which matters enormously in this age group. So the goal is not to feel maximally energetic on the highest dose you can tolerate. The goal is to be correctly replaced. And if you are ever tempted to take a bit extra because you feel tired, please understand that you may be trading fatigue for a fractured hip or a stroke risk. Fourth, dose requirements change over time for many reasons: weight change, other medications, gut conditions, and simply age, which is why regular testing exists. And fifth, on the different preparations, most people do well on standard levothyroxine tablets, though there are liquid preparations for people with absorption problems. And I'd say a word about combination T4 and T3 treatment and desiccated animal thyroid extract, which some people ask about. The mainstream position is that these are not routinely recommended. The evidence for benefit over standard levothyroxine is not established, and in older adults, the T3 component carries particular cardiac and bone concerns, so it's a conversation to have with a specialist rather than something to pursue independently. So doses are typically lower and started more slowly after 70. Overtreatment risks atrial fibrillation and fractures, and the aim is correct replacement rather than maximum dose. Let me explain your blood tests because understanding them makes you a far better participant in your own care. The main test is TSH, thyroid stimulating hormone, and it works in a way people find counterintuitive at first. TSH is produced by your pituitary gland in your brain, and its job is to tell your thyroid to work harder. So when your thyroid is underactive and your hormone levels are low, your pituitary shouts louder and TSH goes up. When you take enough levothyroxine, your levels normalize and TSH comes down. And if you take too much, your pituitary stops shouting altogether and TSH becomes very low or undetectable. So the relationship is inverse. A high TSH means undertreated and a low TSH means overtreated, which catches people out constantly when they read their own results. Alongside it, free T4 is often measured, which is the actual hormone level. Now, two practical points about testing. First, timing, because your levothyroxine dose affects the reading, so the usual advice is to have the blood test before taking your tablet that morning, or at least to be consistent. And after a dose change, you should wait about 6 to 8 weeks before retesting because the levels take that long to stabilize, which is why your doctor won't retest you a fortnight after a change. Second, targets in older adults, and this is worth knowing, there is good reason to accept a slightly higher TSH target in older people than in younger ones, because TSH naturally rises somewhat with age, and because the risks of overtreatment climb with age. So if your doctor is content with a TSH that sits in the upper part of the normal range, that is likely deliberate and appropriate rather than sloppy. And a related point, subclinical hypothyroidism, meaning a mildly raised TSH with normal hormone levels, is common in older adults and does not automatically require treatment. And in the very elderly, the evidence for treating mild cases is genuinely uncertain, so watchful monitoring is a legitimate approach. So TSH runs inversely to your dose. Test before your morning tablet, wait 6 to 8 weeks after any change, and expect a slightly higher target after 70. Let me give you the symptoms of a dose that's wrong in each direction because you are the person best placed to notice. Signs that you may be undertreated, meaning the dose is too low, are essentially the original symptoms returning: increasing fatigue, feeling cold, weight gain, constipation, dry skin, hair thinning, low mood, slowed thinking, and muscle aches. Signs that you may be overtreated, meaning the dose is too high, are the opposite, and these matter particularly after 70, palpitations or an irregular pulse, and I'd encourage you to use the pulse check I've taught, feeling for a chaotic rhythm, a resting heart rate that's unusually fast, feeling hot and sweating more, unintended weight loss, tremor in the hands, anxiety, agitation or feeling wired, difficulty sleeping, loose bowels, and muscle weakness, particularly in the thighs. And there's an important subtlety about older adults. Overtreatment in this age group frequently presents atypically, so instead of the classic agitated picture, you may see simply fatigue, weight loss, low mood, and atrial fibrillation, which can be mistaken for other conditions entirely. So if you have been told you have new atrial fibrillation and you take levothyroxine, that is a genuinely important connection to make and worth raising, because thyroid overreplacement is a recognized and reversible contributor. So report both directions and treat new palpitations, an irregular pulse, unintended weight loss, or tremor as reasons to have your levels checked rather than assumptions about aging. Let me be very clear about when to contact your doctor. Seek urgent medical attention for chest pain, severe palpitations, fainting, or severe breathlessness, particularly after a dose increase, because raising the metabolic rate too quickly in an older heart can provoke genuine cardiac problems. Contact your doctor promptly for new palpitations or a newly irregular pulse, for unintended weight loss, for a marked tremor, for significant new anxiety, agitation, or insomnia, and for the return of your original symptoms suggesting under treatment. Contact your doctor non-urgently but genuinely before starting any new medication or supplement, particularly calcium, iron, or acid-reducing tablets, so the timing can be arranged if your absorption circumstances change, for instance after gut surgery or a new gut diagnosis. If you've been taking your tablet with food or coffee and want to correct it, since that may change your levels and warrant a test, if you're due a review and haven't had your blood checked in over a year, and if you have any questions about your target range. And attend the routine blood tests at least annually and more often after changes, because that is the entire safety system for this medication. And one particular scenario worth naming: if you are admitted to hospital or having surgery, make sure they know you take levothyroxine since it needs to be continued, and if you cannot take tablets, alternative arrangements are made. So chest pain and severe palpitations after a dose change are urgent. New irregular pulse or weight loss are prompt. New supplements and medications need a timing conversation, and the annual blood test is non-negotiable. Let me paint you two pictures. First, picture a woman of 74 who had been on levothyroxine for 9 years and had never felt quite right on it, persistently tired, cold, and constipated, and whose doses had been increased 3 times over the years because her blood tests kept showing she was under-replaced. What nobody had asked her in 9 years was how she took it. She took it every morning with her first cup of tea, along with her calcium and vitamin D supplement, because it seems sensible to take everything together at breakfast. Both of those things reduce absorption substantially, and the calcium in particular was binding a meaningful proportion of her dose before it ever reached her bloodstream. She changed nothing about her dose. She simply moved the tablet to bedtime 3 hours after dinner and moved the calcium to lunchtime. 6 weeks later, her blood test was, for the first time in 9 years, comfortably in range, and over the following months she felt genuinely better and her dose was subsequently reduced. 9 years of a fixable problem, resolved by two questions nobody had asked. Second, picture a man of 78 on levothyroxine for many years who was found at a routine check to have atrial fibrillation and who was started on an anticoagulant entirely correctly. But his doctor also did something else. She looked at his thyroid results and found his TSH was suppressed, meaning he had been mildly over-replaced for some time, quite possibly for years, on a dose set when he was younger and heavier. Reducing the dose appropriately was part of managing his rhythm, and his bone density scan, done for the same reason, prompted treatment for osteoporosis he hadn't known he had. Two people, and in both cases the tablet was right and the details around it were wrong. And let me speak briefly to those caring for an older parent or partner. The single most useful question you can ask is when and how they take it, because taking it with breakfast, with tea or coffee, or alongside calcium or iron supplements is extremely common and substantially undermines it, and nobody ever asks. Help set up a system that works, and if morning dosing on an empty stomach isn't realistic, raise bedtime dosing with their doctor, because a tablet taken correctly at night beats one taken badly in the morning. Keep the supplements separated by 4 hours and check any new over-the-counter purchase, especially multivitamins and antacids. Make sure the annual blood test actually happens, since it's easy to let a repeat prescription roll on for years without one. And watch for the overtreatment signs, which are easily missed, particularly a fast or irregular pulse, weight loss, and tremor, and know that these can present in older people simply as tiredness and low mood, which is exactly what people expect from an undertreated thyroid, so the assumption often runs the wrong way. So let me draw this all together, calmly. Levothyroxine is hormone replacement rather than a drug in the ordinary sense, restoring the hormone that sets your body's metabolic pace, and because it is replacement, the goal is a correct level rather than a maximal effect, which means both undertreatment and overtreatment cause real harm. Its absorption is unusually sensitive, so it must be taken on an empty stomach, at least 30 and ideally 60 minutes before breakfast with water only, with coffee held back for the full hour, or alternatively at bedtime 3 hours after eating, and above all taken consistently the same way every day. Calcium supplements, iron, and antacids must be separated by 4 hours. Acid-reducing medications increase the dose you need, and biotin supplements distort the blood test itself. After 70, the required dose is usually lower. is increased slowly when starting because of the strain a rising metabolic rate places on an older heart, and overtreatment carries two specific and serious risks: atrial fibrillation and accelerated bone loss, which is why a slightly higher TSH target is appropriate in older adults and why taking a bit extra to feel more energetic is a genuinely bad trade. So here's what I'll leave you with, straight and clear. First, check how you take it, because if you take it with breakfast, with coffee, or alongside a calcium or iron supplement, you are almost certainly getting less than your prescription says, and fixing that costs nothing. Second, if the morning routine is impossible, ask about bedtime dosing, which is well supported and much easier for many people to do consistently. Third, separate calcium and iron by 4 hours and check with a pharmacist before adding any new supplement or antacid. Fourth, have your blood tested at least annually before your morning tablet and understand that a high TSH means undertreated and a low TSH means overtreated, and that a slightly higher target is appropriate at your age. And fifth, report both directions of symptoms and take new palpitations, an irregular pulse, unintended weight loss, or tremor seriously as possible signs of too much rather than assuming there's something else, because over replacement after 70 is genuinely common and its consequences, atrial fibrillation and fractures, are serious and preventable. This is a very good medication that asks only that you take it properly and check it periodically. And for a great many people, the difference between feeling well and feeling flat is not the dose at all. It is the hour of the day and the cup of coffee. So take care of yourself, move your tablet away from your breakfast, separate your supplements, and book the blood test you may be overdue. And because doses and targets are entirely your doctor's territory, please treat any change as a conversation with your own physician, treat new palpitations or weight loss as a prompt call, and treat chest pain or severe palpitations after a dose increase as your reason to seek urgent medical care.